An endovenous ablation is a procedure that we can do through just a nick in the skin that's typically used to treat the larger vessels that are fairly close to the skin. It's usually the great saphenous vein or the small saphenous vein. I like to think of those veins as kind of like the trunk of the tree. So from that trunk, there can arise branches, which are often varicose veins, and from the branches often arise spider veins, which are the little small veins that you see towards the skin. So an endovenous ablation is very critical to control venous reflux, which is where the blood goes in the wrong direction across a malfunctioning valve on the inside of the vein. So an endovenous ablation is basically a tool that's replaced vein stripping. Vein stripping is really not done in the United States all that much anymore because there are just better treatments for it. An ablation is done under local anesthetic, typically done in our office. It's through just a small nick in the skin, which is between 1 and 2 millimeters in length, usually in the upper part of the calf, or if we're treating the small saphenous vein, it would be on the back of the calf. What a patient can expect with that procedure is a procedure would last usually about an hour or so from door to door. They'd be either laying on their back or on their stomach in a comfortable position. We would sterilely position their leg and clean their leg before the procedure, access the vein with an ultrasound as a guide, and usually under local anesthetic or just numbing medicine, we would guide a little flexible catheter, which is about the size of the tip of a pen. It's got a blunt ending on it. It's very flexible. It's soft. It doesn't really hurt when it goes in. And then after that, the catheter and the vein are anesthetized with more numbing medicine. We activate the catheter, and what that basically does is it heats up or delivers energy to the inside of the vein and seals that vein closed. The purpose of which is to divert the flow of blood away from that abnormal vessel and into the normal vessels which are left behind. Afterwards, we'll wrap the leg up with a compression bandage, usually from the foot up to the groin or sometimes the foot up to the knee. That bandage will stay on for about 6 to 12 hours, and after that bandage is removed, we'd have the patient put on compression stockings for about 2 weeks or so. What we want to do is to control the amount of blood which reaccumulates in the vessel that we treat, and that's why compression is important afterwards. In terms of pain control afterwards, typically people will take Tylenol or ibuprofen. Some sort of anti-inflammatory medicine is very good for controlling pain, but it's pretty rare for people to need any kind of narcotic pain reliever afterwards.